This is my voice 1 year on testosterone. That is one phrase that I can't believe I can say now. This time last year, I was so skeptical about the fact that I was even able to start testosterone, and I remember how hard that process was in general, and I really can't believe that I've made it to the point where I can say I'm a year on T. But regardless, I have had a few changes, but I have the whole year to document now. So in the last month, I haven't had too many changes, other than the fact that I've definitely got some more facial hair. So I've got some on my chin, which you can't see massively, but there's a good few chin hairs. Moustache and my sideburns are definitely coming in. I'm really happy about that because that's one of my biggest goals, is facial hair. And I do think my face is genuinely masculinizing. Apparently my nose is changing. I don't notice because I see myself every day, but I do think it's changed shape. I do think it's slightly bigger as well as my whole face, but not so much in the past month. So if I'm going back a year ago, I want to go through my changes since then. So my hair's definitely changed texture. It's a lot more fluffy and it gets a little bit curly, and it's really bad right now. I have bed hair right now. I don't really do anything with it when it gets to this length. I usually have it quite short, but this time last year my hair was very thin. I was quite underweight, so that's inevitable. My hairline's definitely changed a bit. It's a lot less round. It's still really round, but it's a lot less round than it was. My face is a lot wider. So obviously, bearing in mind the fact that I was underweight this time last year, quite badly, I've put on quite a lot of weight through muscle as well as fat. But my face is a lot wider here, whereas when you're not on testosterone, you tend to have quite a, I don't know how to describe it. My jaw is a lot wider, whereas it's with just having estrogen in your body, it doesn't get quite wide here, and mine definitely has compared to this time last year. And I'll put my 1 month, 2 month, 3 month video in so that you can see that. My neck's a lot broader, with the weight gain, as well as the fact that I've been working out. I've been a lot less active working out in the last month. I've been quite stressed, but it's been more, my depression's been quite bad in the last month, so I haven't had so much motivation. But regardless, I'm getting stronger every month. My Adam's apple is tiny, but it is there. Got a little thing here. Happy about that. I obviously want it to be more prominent, but it's not something I'm too fussed about. My whole frame, so much wider, and again, in the sense that I was underweight and it was gonna get wider, but my shoulders are a lot wider than my hips, which is something, my goal for so long, and that was because I was quite active at the gym. I was going quite a few times a week, and I was consistent with it, as well as refeeding myself alone. So as a whole, my whole frame is a lot wider, but it's a lot more masculine now. So I've had some body fat redistribution. I'm probably not going to put in too many photos of that just because I'm quite insecure, but I will put in some of my body changes between then and now. So my chest hasn't really changed. It's definitely bigger, and that's down to the fact that I have built muscle under it. So the breast tissue I already had will appear like there's more just because of the muscle under it, but my chest is very shaped quite masculinely, so it's quite to the side, but I won't be inserting photos of that. some good news. I'm gonna go on a ramble now. I am getting top surgery next year. I've got my top surgery referral, and very soon I'm going to be contacting a surgeon and planning that. So this time next year I will be making a video about the fact that I'm getting top surgery. Maybe. I might not document that immediately. Anyway, hips. Hips are quite like the same width, but the fact that I've built muscle, they appear narrower, so it levels out. Same with my legs. My legs are a lot bigger than they were just because they are mainly muscle now, and the fact that I was so small. But they don't look feminine. They look quite masculine, and they're not curvy because of the body fat redistribution, as well as the fact that I've been going to the gym. Body hair, I am hairy. I am very hairy, and I expected that. I have very hairy genetics, but I didn't expect it to be this hairy this early on, and I'm very happy about it. But there are certain places on my body that I am not so happy that I have loads of hair on, and it can be quite frustrating, and my sensory is not exactly the happiest, but it's it's okay, and it's all part of the process. Like, it's something that you're gonna have to put up with if you want to start to. So overall, body hair, my legs, my arms, very hairy. My stomach's getting quite hairy. I'm starting to get blonde hair all over my chest, as well as a few wiry ones. Obviously my face, my back's hairy, and then just everywhere else. There hasn't been any change in height, and there hasn't been any change in my hand size, other than like the fact that they're thicker, and I did bricklaying for a little bit, so they're a lot tougher, as well as my feet are the same size for now. But I know a lot of people say that they actually go up in shoe sizes, which I haven't, but I might. Now, little content warning, because I'm going to talk about bottom growth now, and not everyone wants to hear about that, especially my family, so please skip to the time that I'll put here. I have experienced bottom growth. I've probably experienced about an inch growth, and I'm very happy about that. I am very euphoric from that because it's less feminine to have that, and I'm very glad. And I have no complaints. I wish it was a little bit more, but I'm still early on. I've still got a year of growth at least, so no complaints there. But I want to document that because I remember when I was starting to hear, I was watching videos just like this all the time, and I wanted to hear about other people saying it, but a lot of people won't talk about it just because it's very sensitive to them. My experience has been it's quite irritating, but it's only been irritating if I've been wearing boxers. So when things get really, really irritating, like the peak of my growth, I can't wear boxers very much because it's just too much on my sensory, and I know a lot of trans people are the same, but it's not painful, for me anyway. I know a lot of people say that it's quite painful, but for me it was never any issue with the pain. It was more like a light throb and felt like there was a lot of blood, but other than that, no. But I'm going to change the subject now, so I will end that conversation. My voice has obviously changed quite a lot. I had quite a high voice before, and now my voice definitely passes as male, which I'm really glad about. My voice is probably one of my favourite changes, as well as the facial hair, and the fact that I am starting to look more male and older. A lot of trans people have the issue of looking quite young, and I still do have a bit of a baby face, but I don't look 14 anymore, I don't think. For a while I looked like a 14-year-old boy, and I think I look more my age now, which is really nice, because then I don't get assumed that I'm that young, and I've definitely gotten past the T-boy voice. I think my voice is neutralizing. I'm going through a little bit of voice cracks at the moment again, so maybe there'll be another voice drop. But that's, I'm trying to think, like, is that all the changes or not? There have been so many changes in the last year, and I'm, forgive me if I leave any out. One thing I would say, because there are pros and cons, one of my cons was the amount of back knee I got. Now, it's all cleared, almost all cleared now, but between, I want to say, 3 and 10 months, back knee was awful, and people always openly talk about this. I'm very lucky. I've kept very clean on my face. I haven't got acne on my face or anywhere else, but my back was really affected, and I had to, I didn't really bind. I don't really bind anymore because it's just so bad. It's not anymore, but for a while it was really bad, and it was very irritating, and I felt very unattractive, and it was very frustrating to have that as an effect. Obviously, everyone gets affected differently. I went through all the typical changes as well as the negatives. I didn't go through all of the negatives. I will say that you smell very differently, and I'm doing this so out of order, so forgive me, but I noticed probably after about 9 months that my odor completely changed. So I smell very stereotypically manly, I smell quite musky, and I definitely smell a lot more. So I can just go for a walk and I'll stink, even if I'm wearing deodorant, even if I'm not sweating that much. And then that's another thing, you sweat a lot more, so you have to change more, and it's all part of being a man on testosterone. Just trying to think of the other changes, really. But it's really weird for me to be able to say that I'm a year on T, and if I'm really honest, on the mental health side, I really didn't see myself making it. Testosterone definitely saved my life, but it didn't take away my issues, and it didn't take away how hard life is for me. And as an individual, I've been through quite a lot in the past few months that I haven't been open about, and I do advise anyone who's in the same position to seek help. Something that I should have done, and I am doing now. And it's not something to be ashamed about, being a man and having mental health problems. I know that since being on T more and more, and the more I pass, the more actually I feel unable to seek help, because I feel invalid in my masculinity, which is something that is a really bad mindset to be in. It's very toxic, and it's not right. Men struggle just as much with their mental health, if not more, because they don't seek help, and it's not invalidating women at all. Women are just as valid as men. But I know, as a man, since being a man who passes, I haven't felt as able to seek help as when I did not pass as a man and identified as a woman. So I guess what I'm saying is, like, even through hormones, things don't necessarily get better with your mental health. I know testosterone really helped my dysphoria and my anxiety, because I'm not anxious about picking up the phone, I'm not anxious about leaving the house, being discriminated against all the time. I still get discriminated against because, I'm not, people don't look at me and think that I'm a straight man. I don't know my sexuality, but I've been called lots of slurs, and that's just part of it, which is something that I wish I didn't have to say, but I still get heavily discriminated against. And I'm sorry to everyone else who does, because it's something that we shouldn't have to live with, but we learn to accept, and that's not something that we should have to learn. And it hurts, not being accepted as the person that you are. In the past year, I've made a lot of changes to myself, and a lot of changes have happened in my life. this time last year, as I said, I was severely underweight. I have anorexia, and it really hit me in 2022, and through the whole of 2023 I rebuilt myself, I refed myself, and I built a lot of muscle. I also moved house. I live alone, quite far from where I used to live, and I live independently. I go to college. I passed my GCSEs. I have done a lot in the past year. I starred in a short film. It's been a busy year, and I really struggle to say this, but I'm actually quite proud of where I am now compared to this time last year, and I might not be making the best choices all the time, but I'm alive, I'm breathing, and I'm getting closer to the person that I want to be. And I really want to be that influence on someone, because this time last year I was so lost, and I still feel so lost, and I admit that. I don't want anyone to ever think that testosterone will solve all of this, but I'm still so lost mentally, and I'm still struggling really badly, and I don't admit that very often. I'm really not doing the best, and I'm trying to get through it, and I'm doing everything I can, but it's really important that other people can hear that things aren't just going to get fixed, because you still need to make an effort on fixing. Well, you're not broken, but healing. You still need to make an effort on healing, going through therapy or whatever helps you individually. It's really important that you keep doing that, because you can't rely on a hormone to take that all away. Testosterone is known for making mood swings a lot more unstable, and as someone who already had unstable mood swings, that was quite difficult. Now, one of the misconceptions is that you are just angrier as a person, and I definitely feel rage a lot more, but that's usually not because I'm more angry. It's because I get angry about the fact that I can't outlet my other emotions, so I can't cry very much anymore. I've been crying a lot lately. My life's been quite hard lately, but it's a lot less than before, and that repression can lead you to outbursts, and that's something that I've definitely dealt with. Like I mess up my hand every few days, you know, and that's not a good thing. And I'm smiling because I'm uncomfortable, because I'm not honest often, and that's just something that we are used to doing, lying and pretending. But like, you are so valid as a person to experience these feelings, to not feel better than you were. The whole reason I went on testosterone was to be able to find a part of myself that I had not been able to find, and to feel more aligned to my body, and both of those things have happened, and I am so glad. And I do not have one single regret about starting that hormone. But anyway, I'm going to insert some photos now, and I am going to put my full year on now. My name is Noah Wild, and I am 1 year on testosterone.
I'm 1 day on 1 month, 2 months,
3 months, 4 months, 5 months, 6 months, 7 months, 8 months, 9 months, 10 months, 11 months on. Hi, I'm Noah, and this is my voice 1 year on testosterone.